We are educating the next generation of caregivers. Okay. And we have Alexandra Gleason, the Director of Clinical Education at M42, who's going to be taking to the stage. I love that entrance. You are really showing me up, Alex.
I know. I'm a little nervous.
Okay, so let's between us introduce your speakers because I feel like you're going to be.
I have a sheet.
You're going to give a Dr. Swarson Abdul Zaig. Yes.
Yes, right here, coming
Chief
in.
Academic Officer of Cleveland Clinic,
Woo!
Abu Dhabi. Please join
Big
us
clap.
on stage. Professor Lisa Pratt, Director, Chief Academic Officer, Fatima College of Health Sciences. Nora El-Kabi, the Youth Majlis President at M42. Thank you so much all for joining us. Give our next panel a huge, huge round of applause. We are looking at educating the next generation of caregivers. Over to you, Alex.
Yes. Can I change the, okay. This is like a classroom. All right, you were supposed to sit underneath your name. So Dr. Swanson, we need you to move over here. And then Nora, can you move over here? That's great. We're also taking attendance because we are all academics, so nobody can leave because we know who you are. So welcome to a nurse and allied health educational focus session. Not that we don't love our physician colleagues, and I love gut biome because I'm American. But today we're going to talk about innovations and technology to educate the next generations of caregivers. So, can anyone guess what percentage of our caregivers are Emirati nationals? I have a big gold star for whoever gets it right. Nobody? Nobody? 2%. 2% of the workforce are Emirati nationals. The other fun stats are there is healthcare caregivers are ranked as number 9 in the Project of the 50s. So anyone who was around in 2020, in the 50th anniversary of the UAE, remember the top 50 projects? That means nurses and allied health are the number 9 most important program in the UAE, which is why we have our distinguished panelists here. And the last one for the finance people out there, for every dollar spent on education, we return 3 times that amount in economic development for your community. So, without further ado on here. So, Ms. Nora from the Youth Council. Ready? I feel like this is a game show a little bit. What do you think inspires and attracts the next generation of young people to consider a career in healthcare?
Thank you, Alex.
Hold it up close.
Can you hear me now?
Yeah, there you go.
Okay.
Good.
Thank you for your questions. The next generation is inspired and attracted to consider a career in a healthcare sector for several reasons. One of them is the opportunity to make a meaningful and a positive impact on people's lives is a motivating factor. Healthcare professionals have the ability to save lives and to improve the well-being of individuals and communities, and this sense of purpose and giving to others is very appealing for young individuals. Secondly, the advancement of technology and innovation in healthcare has created a very dynamic and exciting field. The younger generations is drawn to the opportunity to work with cutting-edge technologies such as telemedicine, artificial intelligence, and personalized medicine, and they see the healthcare sector where they can contribute to the groundbreaking discoveries and the advancements that shape the future of the healthcare. Also, there has been an increasing understanding of the significance of mental health and the integration of the alternative. Also, there has been an increasing understanding of the significant health and the integration of the holistic approaches in healthcare, which attracts many young individuals. The emphasis on raising the awareness about the mental health and the integration of the alternative therapies such as art therapy and music therapy made the healthcare more inclusive and more diverse. Thank you.
That's great. Great answer. So sort of following up from the technology and AI, and that, Dr. Swanson, can you explain how Cleveland Clinic is using AI and technology to help the healthcare education prepare for the next generation of treatment?
Firstly, thank you for having me. And you know, AI and learning technologies is the thing. It's the buzzword. Everyone is talking about that. And the question is, as clinicians, we're learning how do we implement that in our spaces, and then how do we teach that to that next generation of health professionals? No one has the answer, but I can tell you some of the applications that are already in use, and I can tell you what the future direction really is when it comes to education and AI and technologies. The first thing is that the teaching paradigm is going to change, right? The current paradigm is one that is extremely focused on diagnostic paradigms. We teach our students every day, whether physicians, nurses, allied health professionals, how do you diagnose the disease, right? So we spend a lot of time on that. And then how do you manage the disease, right? What we're going to have to start doing is move that paradigm away from diagnosis, because we know, the literature shows us, AI is doing that really well for us in many areas, whether it's imaging, whether it's in other areas of healthcare. So that means that as we teach, we have to teach students how to best prompt AI. What are the types of questions you should be asking AI? Because AI is going to be part of the workforce, right? Some of that care is going to be delivered by AI-enabled technologies. So that's number one, right? So just changing the curriculum and the paradigm of how we teach, right? The second piece is, okay, well, what can we do to improve our teaching? How do we use AI to do that? Few things that are out there. Simulation, I know my colleagues will talk about that. So looking at using safe spaces, right? AI-enabled safe spaces for learning. The second pieces are around how do we as educators take data that we gather from our trainees, and how do we use that to improve their learning, right? So adaptive learning technologies, for example. The third piece is obviously clinical decision support, right? So obviously a lot of the AI-related applications are all in that space. So students were going to have to learn, well, how do I use an LLM to ask the right question? How do I feed the right data into the algorithm? So when thinking about research, right, obviously implications for AI and research are large. We don't have enough time around that. But what I will say is that's all going to have to be incorporated in how we teach. So a lot of the ways that we're doing it now at the Cleveland Clinic are related to those three areas, okay? I'll pass it back to you.
That's great. And so let's follow with Lisa. How are you using simulation and technology in the undergrad space?
Well, thank you so much for inviting me here, and it's wonderful to be on this panel with Noor and amazing organisations such as Cleveland Clinic and obviously M42. I think first and foremost, 50% of all of our programmes are based in practice, so being really close to the partners and ensuring that all of our education is aligned with what the industry needs for now and tomorrow is absolutely critical for us. Secondly, it's so important, and I think Noor might back me up on this, is that we need to make sure our education is fun. So I think it's important that we educate and entertain our students. So we have fantastic clinical simulation facilities in the college. We're moving a lot more of our education into that space. Our students want instant feedback. They don't want to wait for a month to find out their results. You want to know instantly. We're developing self-assessments, quick feedback, and also peer learning. I think it's really important for the next generation to be supporting each other on the learning journey, because I think, like you said, Dr. Swanson, the knowledge base now is so complicated. There's so much aggregation of information. You've got to collaborate with your peers in order sometimes to decipher that, to say, actually, which decision am I going to make or take with this? So from my point of view, it's absolutely about really working closely with the people on the ground that are using the technology. It's about immersing the learners in real life experiences as much as possible. And it's also about having fun, so that actually our next generation have really great memories of their education, and therefore they want to continue to learn as they move into their professional careers.
That's great. Thank you very much. So Nora, can you speak? You are the Youth Modulus president. Can you speak a little bit on how the Youth Council helps that sort of continual professional development for healthcare?
Thank you for your question. The M42 Youth Council is committed in supporting the continuous development of caregivers through the M42 Youth Council is committed in supporting the continuous development of caregivers and through the collaboration that we do with the organizations and other youth councils. These initiatives aims to provide them with the necessary tools and skills which will develop their personalities in terms of responsibilities and leadership, So yeah.
That's great, super. And so with that, developing their leadership on Cleveland Clinic, do you have any issues with retention or innovative ways to increase retention for our caregivers?
No,
No. Excellent. See? Done.
no issues.
It's all full, yeah.
No, so obviously, healthcare workforce retention is a challenge that every single healthcare facility has around the world. And if there's anything we've learned from the pandemic, it's that healthcare workers are gold dust, right? We are now across the globe competing, right, for these healthcare workers. So yes, there is an issue with retention across the board. Now the question is, what are we doing about it? So I think it's important to recognize, and to go back to the earlier question that you'd asked Nora about, why do people enter healthcare? It's a calling, right? That's what we all say. There's meaning and there's purpose behind what we do, right? We're one of those disciplines where it's not hard to find that value, right? Now, how do we keep making you believe you still have purpose and meaning and have value, right? That's the question on us as employers, right? So there are a few things. The first is opportunities for professional development is a big thing. This is an area I know that as clinicians feel that they have investment in their own growth and learning from the organization, it makes a difference. Second piece is fostering an academic environment. This is extremely important, right? You can be a health service provider, but without that underlying or underpinning of education and research, it is oftentimes not as attractive to some healthcare professionals to stay there, right? Because part of that is they want to have those tracks where they become faculty members, right? And they have adjunct appointments, or they can do clinical research, right? Or any type of research, translational, basic research, right? The idea is they want to be able to ask the questions and actually explore those questions and find the answers, and they can't do that if there isn't a very clear research arm, right? So that's another component that a lot of our caregivers value. Another one, which we all value, I think, work-life balance, right? Easy to say, hard to do, right? But the idea is, again, opening up employment tracks that are diverse, right? So that you can do a part-time position, or you can work in a hybrid manner, or you can do some work from home, right? So having those tracks. Another area is, of course, being able to practice on multiple levels, right? So yes, it's great to see the patient. The patient always is the center of care. But, I also care about the population. I also care about different settings. So again, having career tracks within those different settings, right? That makes a big difference. So people feeling that they do have some autonomy in their practice. And then, of course, lastly, the actual work environment, right? So things around compensation, promotion, autonomy in practice, right? How we work with each other as a team of healthcare professionals, right? All those things, I've only mentioned a few, so I know I can be here till tomorrow, but those few things are critical in keeping our workforce in the workforce.
Excellent, thank you. Sort of the same question from the other side, Lisa. You worked a lot in the UK and the Western world. What are some different models that all of our friends out here could consider when they're trying to attract people into nursing, or more importantly, the academic and hospital relationship? Like, if I gave you Elsa's magic wand and said, we're going to change your hospital, what are some ideas that we could think of?
I think I would just like to say a huge thank you to people in the UAE for welcoming me from the UK just over a year ago. I've felt so supportive and loved. I'm a nurse by background, and the nursing fraternity and others in the profession have been so warm and welcoming. So I think we're very special in the UAE, because I think there's a lot of kindness and compassion already amongst our partnerships working together. I think the real thing for me is that close working between the college and the providers, and it's about providing as many opportunities as possible to partner at numerous levels. So whether that be involved in the recruitment process of our students, whether that definitely being involved in the curriculum design, ensuring that we have high quality placements and practice education, and really working this theory practice gap so that it's invisible. There is no theory practice gap. We're back and forth all the time, and where I saw that the best models, I guess, US in the UK was where you didn't know if you worked at Cleveland Clinic or at the college, because guess what, you belong to both, and we were all trying to achieve the same thing, which was to improve the outcomes for the patients that we were caring for. So I think we're very lucky in the UAE because there's a hugely supportive community out there, and it's how we can keep building those relationships, you know, from everything, I think, to deciding on how many people we want to recruit, through to ensuring that they have great opportunities in clinical practice as early as possible, and further down the line into professional development, research, CPD, and that whole engagement piece about how do we keep each other going, how do we keep each other motivated, because we all know that the emotional labour that we have on health, it is difficult to be a healthcare professional. It's hugely rewarding, and Nora and I were talking about what's a better job than actually caring for somebody and making their day in a huge way than being a healthcare professional. But on the flip side, how do you make sure it doesn't drain you? How do you create a supportive team around you? And how do you know when it's time for a bit of a break? So I think, you know, academic and practice interfaces can help that, because sometimes it's quite good for clinicians to step out of the front line and step into generating the next educating the next generation for a while, and then going back into practice. So this back and forth, I think, around academia and practice is one way to keep that vibrant community live and well.
That's great, thank you. One more question that anyone on the panel can answer, then we'll go out there and try to find some brave souls who can steal the microphone away from me. It's hard to do. So we've gone around, we're here at Arab Health. It's one of the biggest conferences here in the Middle East. We've heard some, if you read the front page of the national paper today, that some hospitals are actually looking to use robots to replace nurses. How do you, from an academic point of view, like, I don't want to cause controversy here, Ben, but if I were, say I was a financial officer and said, we don't need nurses, we can do robots. How do you, from an academic point of view, make that case against finance? Anybody? Go ahead, Lisa.
Oh, my goodness. I know this work has been going on in Japan, actually, and many moons ago I was in touch with Chiba University about this very thing. So at one level, we already have it. If we think about some of the automations, if we think about, certainly in the UK, in care homes, there were devices in people's room that helped to identify when people were at risk of falling, which prevented carers going into the rooms every hour to check if people had fallen. So this has been happening subtly for a long while. But the bottom line is that nothing replaces the human touch, the human heart, and compassionate care. But can we be more productive with artificial intelligence? Can robots enable the jobs that we don't want to do, or the boring jobs, to be done more efficiently? And actually, I think we all use robots in various ways, whether we know or not, with our phones. So I think they're in our lives, they're here to stay, but they will never ever replace kindness, compassion, and the human heart. And I would fight to the death with any finance director about that.
Excellent, thank you. Dr. Sosa.
Yeah, I think I agree. I do want to add a point. I think it's important to recognize that I don't believe robots will replace clinicians, but clinicians who use robots will replace those who don't. Okay? So that's extremely important, right? So incorporating robots in our practice is what we should be doing. And as you've mentioned, Lisa, in some areas that she's mentioned, but in other areas, it's okay. And maybe I'm somebody who'll be out of a job very soon, but it's okay for me to incorporate AI into my practice in the ways that it makes sense. So there's a nice JAMA article published a month ago around actually AI chatbots beating physicians in empathy and professionalism, right? Which are the areas we say, oh, they can't beat us in those areas, right? But then again, very limited, in a very limited application, right, around responses to questions of patients, right? At the end of the day, we are all overworked as healthcare professionals. There are areas where AI can come and do a better job because they are not overworked, right? It's all about how we implement, right? That's why, to go back to my previous statement, the clinician is going to have a more integrative, human-centered, inquiry-based mode of practice and move away from diagnosis and management, because that will be covered, right? And so those are my 2 cents around it.
Excellent, thank you. Any comments from the crowd? Anybody wants to defend the robots? Yes, go ahead. Oh, you got it. Thank you.
Thank you. I'm Manjeet Garcha from the UK, nurse and midwife by background.
Yay!
Lovely to see you, Lisa. Very proud of you. I was just thinking, around the world today, whichever country, they're all having this conversation. Because globally, there's a shortage to attract, recruit, retain, and everything that you've said. Is there any merit in global get-together, sharing best practice, and actually offering those nurses the opportunity to also have a global portfolio? Because if I had that opportunity 20 years ago or even 10 years ago, I would have snapped it up like that.
Great question, thank you. Dr. Sosin, you were seeing a proud alumni from Johns Hopkins.
Oh, yes. So I think one of the issues in order to enable that is portability of health professionals across the globe. This is a major issue, right? And as you know, there's been some easing of those restrictions, especially around nurses, right? Once there was a shortage, right? So it's doable. It's not that it's not, it's totally doable. The question is, well, how do we do it in a way that is safe? How do we do it in a way that, again, remember, a lot of our practice is very much informed on the socio-cultural, legal, economic circumstances in which we practice, right? So how do we do that such that there is a way to transition global providers? So I'll tell you something about the Cleveland Clinic real quick. This is my first plug, which is that, as many of you may know, the Cleveland Clinic is in London, it's in Canada, it's in the United States, in the UAE. We're one of the few global providers, actually. In the ongoing conversations, I sit on a global education optimization group, specifically talking about, like you said, we're all talking about this. How do we move those health professionals seamlessly to take care of an increasingly globalizing patient population as well, right? And so a lot of it is going to be around talking with the regulators, licensing, credentialing, whatever, right? We're going to have to talk to them, figure that out. We're going to have to understand, well, what are the very clear objectives that we're planning to, what are the metrics of success? What does it mean? What does it look like, right? Why are we doing this? So all of that, we have to put that very clearly. And then I don't think it's, once those two things are done, very easy. Once those two things are done, I think it's a possible proposition that you've put forth.
That's great. Thank you. One more question. Yep. Do we have another mic?
Thank you very much. I'm Bao, a pediatrician from San Francisco. First of all, thank you so much. It's such a very inspiring session. And I think I cannot agree with you more that there is this obsession about diagnostic and fact-based stuff in our education that probably obsolete very soon. But we don't train our workforce on the compassion, communication, things that the robot never able to replace us, right? So I think that is such a great insight, and I don't know, I haven't heard anyone who express it in words in a better, But my question is this, I think to follow up with that great question before, how do we train our workforce on multicultural and kind of respectful of patients who are coming from different backgrounds? Because, for example, if you, especially physicians, you grew up in a certain educational social economic settings, and then now you work in a different environment or working from patients from a different background. How do you think both how our education system globally address that issue, multicultural, settings, and second, how the technology might be able to help?
That's great. Lisa, do you want to take the education side of the empathy and multinationalism?
Yeah, I mean, thank you so much for that. I think for me, and what I've learned over the years of recruiting people into the health professions, is that you've got to have values-based recruitment. At the end of the day, you need people to have the right values if they're going to be great practitioners in care. So I don't think we can lose sight of assessing people's values to start with. I think what's also incredibly interesting when you look at a lot of clinical teams is they're diverse by their very nature. I mean, in particular, I'm sure Dr. Swanson can have some fantastic statistics around what the makeup of Cleveland Clinic workforces consists of, but it's absolutely made up of a number of different professionals. And I think for me, leadership training, I think having respect, I think going back to dignity within teams, continual conversations about how do you create the right cultural environment to deliver excellent care. So it's almost like a proxy. I think actually it's a proxy for great care. So where you have a really good team dynamic, where you've got people that are respectful of each other, you'll have great care. And the opposite is true when you see poor care. And, you know, we absolutely very sadly saw that in the UK a number of years ago that led to a damning report by Sir Robert Francis that really unpicked this poor culture that then resulted in devastating care for people. So for me, it's not one thing, but it's a proxy for great care, and great organisations will absolutely have it, I think, as a cornerstone of actually what they do and what they believe in. But over to you, Dr. Swanson.
Yeah, I couldn't have said it better. I will say one thing. The first thing is what you've described: empathy, professionalism, compassion, etc. All of that we traditionally called soft skills, right, are actually the hard skills. Those are the hard skills, right? I think I'll just add to Lisa's comment with one thing. I'm a firm believer, so I've published a lot on medical professionalism and cross-cultural medicine, et cetera. And then several years into it, I was like, wait a minute, what am I talking about? And so I'm moving more towards, and this is again very personal, universal concepts of care with dignity, right? Because as different as we are, we're actually much more similar than we are different. And one of the things that I really believe is to teach the trainees what are the core concepts behind the human condition. What is it? And again, calling it the human condition, not the Chinese condition, not the Egyptian condition, not just the human condition. What are those core things? And then what are some pieces that are informed by social, cultural, political, economic, factors? They are. But I think we've moved so far into teaching students how to deal with the Chinese patient and whatever, that we've moved away from not othering them and making them the same, right? Saming them, and then thinking about, okay, how can I improve my care of this patient by understanding a little bit about their social cultural context. So I sort of flip it around. I don't know if that's answered your question, but I've moved more towards that because in my practice, I found that even if I blunder with a patient culturally and I do something weird, as long as they know what the intention is behind it and they trust the care that I deliver, it's okay. I will grow and learn with them, right?
That's wonderful. Thank you very much. Thank you all. Can I just have a raise of hand for all the nurses and allied health people in the room? And a round of applause for them. Thank you very much. And also for our distinguished panel, Dr. Swanson from CCAD and Lisa, Professor Lisa, from Fatima College and Miss Nora from the Youth Majlis. Thank you all. They'll be over there for questions afterwards. But thank you for coming.